So we know that this is an intense decision for students, and there are a lot of things they want to consider. The obvious is, what kind of training do you get? How are you respected as a family medicine resident? How many different medical experiences do you get, and who are the people you get to work with? But we also recognize that the value system, how people are connected to their communities, things even like benefits, the use of technology in the clinical setting, those are all things students might want to think about as well. So what we did is put together all those considerations in a format that allows them to easily access them. And then as they're going around and interviewing at programs, just rate them by touching a little slider bar on the iPhone. And they're able to add their own criteria. So for instance, if it's really important for someone to learn how to do a certain procedure, or they really want to have a strong pediatric experience, they can add certain things in, but they can also delete items as well. So for instance, one of the things that's included in the community is, what are the school systems like? What are the child care opportunities like for resident physicians? If somebody doesn't have kids, obviously they're going to delete those criteria out. But as we were making this application, what was really fun is it allowed us to reflect on our value system and say, hey, if these are all the things that people are thinking about, how are we doing in these areas? And it was really a team effort, very fun to just take one of those hey, we oughta ideas and then see it actually come to fruition. We were just in Kansas City for a national conference that's for medical students going to be choosing family medicine, and that's where we introduced it. And it was really fun for me because as I talked to some of the other programs, they were saying, oh, I can't believe you did this. This is such a cool thing. I wish we would have done it. And we got a really nice response from medical students who found it very useful. We don't expect that a medical student's going to rank all their programs, look at the total number that they get on this ranking, and enter that into their match list. Of course, that's not going to happen. But what we do hope is that this is a way that students can think about different parameters of their decision. And I think what we feel pretty proud about is we can say, hey, look, here's the Wisconsin programs. You feel free to kind of compare us to anybody, and we think we've got a pretty good product.